Hello, and welcome to another installment of Coffee and Tea with AARP. This biweekly program is an opportunity for AARP staff and volunteers to speak with experts and decision makers and ask questions about issues that impact older adults. My name is Anna Doroghazi, and I am one of the policy directors at AARP Connecticut. I'm excited to be joined today by the wonderful Tia Murphy, AARP Connecticut's volunteer state president. Welcome, Tia.
Thank you so much. Great to be here, and this is exciting. I can't wait to dig into this.
Thanks. I'm also very pleased to introduce today's guest, Dr. Elizabeth Dugan. Beth is an associate professor of gerontology at the McCormick Graduate School for Policy and Global Studies at the University of Massachusetts, Boston. And she and her team are responsible for developing the Healthy Aging Data Reports, which are available for Massachusetts, Rhode Island, New Hampshire, and now Connecticut. Visit healthyagingdatareports.org for more information. Welcome, Beth. Thank you so much for being here.
Thanks, Anna. Thanks, Tia. It's great to be here.
Great. And we mentioned those Healthy Aging Data Reports, which is the topic of today's conversation. So I think we're going to just jump right in. We'll make sure we provide some links where folks can find the data report. And yeah, we'll go from there. This will be an exciting conversation.
I'm really excited about this. I've read it through several times, so I know there's just a lot of great stuff. But before we begin, just give us a quick heads up as to what it is, Beth, that you do at UMass Boston, and how you got to be involved in this project, because this is really a wonderful area, and this aging data report is just fabulous.
Great. Thanks, Tia. So at UMass Boston, I'm a professor of gerontology. So I teach students about aging and healthy aging. I administer an undergrad program, and we're always looking for students. And we have an online certificate program if people want to continue their education. And then I also lead a large, busy research team. And in, I think it was 2012, the Tufts Health Plan Foundation was interested in developing scorecards or benchmarking of healthy aging in Massachusetts, and they put out a call for proposals. And my colleagues, Frank Perel and Nina Silverstein and I put our heads together and figured out a way where we could report at very local levels information that were indicators of healthy aging and things that were associated with healthy aging. And so we were fortunate and won the call for proposals and put out our first report in 2014 in Massachusetts with something like 90 indicators. And we've just released our most recent one in Connecticut in 2021 with 190 indicators. So we just continue to keep getting advice from people who use the data reports on how to make it better and more useful to advocacy or policy work in the various states. So that's sort of how we got started.
Well, for people, if someone's not familiar with the report, can you tell us a little bit about what is contained in that report and why that information is so important? Because you talk about policymakers and different advocates. So what's there? What will help them inform their opinion and help guide them in their process going forward?
Yeah, we have tried to become the definitive source of information. We think people can make better policy decisions if they have accurate data to inform them. So we have information about population characteristics, including age, breakdown, and race and marital status, education level, housing and economic status, all that kind of stuff. And then there's a lot of information related to chronic disease. And so if you're, for instance, in the Alzheimer's Association or the Dementia Friendly work, those indicators can be very helpful to know where there may be underserved. There may be opportunities to add support groups for caregivers in communities that have high rates of Alzheimer's disease. We had a hospital or a health system figure out where to put a memory clinic, to assess memory disorders by looking at the map and finding communities that had high rates of Alzheimer's disease and related dementias. So it's information that is often reported at the national level or at state level, but what is sort of the secret sauce about what we do is we talk to people in the state, find out what they're working on, what are the priorities, what are the challenges, and then we report it at very local levels, sometimes even at the neighborhood level, which is unique. And that allows you, every state has pressures, financial pressures, and so there's not often a lot of money to spend on services for older people or for anyone. And so helping policymakers or people who provide services know where the hotspots are or the trouble areas are can be really practically important. And that's what we're trying to do. We just want this to be a very usable piece of research that helps people.
Well, one of the things I loved about it, because I'm sort of I love digging into demographics and statistical information, was that you could go town by town for each one of our towns in Connecticut, because we don't have a county government. We have individual and very individual towns. And that was fascinating to me to go and look at towns surrounding me where I knew different things about it. And I was just learning tons about how my town really did look very different. But then together, where were the things where we had some overlap, like kind of a Venn diagram, where the two circles went over each other. It was fascinating. So I think that's very helpful. And for people who want to look at it, you can drill down that deep. But let me ask you this. So what did you think was the most interesting thing or most surprising thing that you found as you were going through and looking at this information?
Oh, that's a great question. Every state is unique. I want to say that, and we do see differences. I think two things that struck me about Connecticut was, one, it had the most diverse older population compared to the other New England states, which I think is interesting, and I may not have recognized that beforehand. And then the other thing that was very interesting about Connecticut was the differences in rates were, it was wider than we see in some other states. And so the people who had very low rates, or the communities that had very low rates on asthma or heart disease or diabetes, and then other communities had very, very high rates. So you just saw this range of values that was really remarkable. So I think, to me, that was and I'll say I have a family in Connecticut. I was born in Connecticut. So this was, in a lot of ways, a labor of love to do this data report. But the racial diversity and then the disparities in healthy aging were the two things that stuck out to me.
Did you see anything that you saw across the state that were elements that were the same everywhere? If we were to look at top issues that cropped up almost everywhere across Connecticut, do you have any sense of what those may be?
Yeah, I mean, we have this one map that shows one dot equals 100 people age 65 plus. And if you look at that map, there are dots everywhere in every community. And so to me, what that means is that aging in Connecticut is happening everywhere. There's not some community that is missing this demographic transformation. And so I think that's something that maybe deserves a little awareness or a little conversation, because sometimes, again, it's easy to overlook the promise and the problems of late life. And so recognizing that it's everywhere, and it's actually good news. We're lucky that we have this experience that we're undergoing. And to maybe start to help people to think about older people as the solution, or instead of as a reason to cause panic or that it's a problem, but to recognize that, here's a large segment of the population that may be less engaged with the workforce and yet still wants to contribute in meaningful ways. That's a lot of manpower, woman power, human power that we can tap into to solve problems. So I think it's an exciting time for us. But we have to help our friends and colleagues to recognize that it's a good time to tap into the older population.
Well, so one of the things, I mean, I agree with you that it's always interesting to me how diverse the population is here in Connecticut. I think it's always a surprise to people because they don't really think of that. But then also when I was looking at the information, there were a lot of health disparities that seem to go along with different population segments or different areas. Can you talk a little bit about those health disparities and how you see are being able to, I say, promote that understanding and awareness about what those disparities are and try and come together to give some solutions for that?
Yeah, you just see patterns of disease with this generation that align pretty closely with income or education, and sometimes race can be a proxy. I always remind myself and remind my students that within a particular group, we see as much variability as we see when we compare across groups. So that's an important thing I try to keep in mind. But you just think, in the last year or two, there's really been, I think, a racial reckoning in our country. And thinking about, and I think it was President Biden, where think of what it must take for a Black man to love the US or something like that, to love our country. And it's like, if you think of the lifetime, sometimes exclusion, sometimes hostility, the differences and experiences and opportunities that people have had, often due to race, it would be hard for there not to be an accumulation of impact when we got to old age. So I understand it. I think we'll mitigate it in the future, but we're not there yet. I think we're in the process of it. So we have some work to do.
Yeah, well, and to that point, there was a really incredible kind of pull quote in the Connecticut Healthy Aging Data Report that I just wanted to read and maybe get a little reaction to from you. But the report notes there were disparities in 56 chronic disease, mental health, and health services utilization indicators. There were only 4 indicators: heart attack, liver disease, PTSD, and stroke, that did not have racial disparities. So I saw that and just thought, this is an incredible finding that so many of the indicators included in the report point to racial disparities. So what does that mean for us as a state? I know, one of your hopes is that this data is going to be used by, influencers and policymakers. So what do we do with that now that we have this information? How can we improve on the world that we're living in?
Yeah. We should look upstream, and so improving early education across the state, that would pay benefits in healthy aging in a generation or two. So that would be, childcare, access to childcare and that type of thing for the folks who are older now, who have lived through, and you just think if someone's 80 or 90 now, think of what their experience was like in terms of racial justice and segregation and Jim Crow and you name it. So policy can be a tool to make things better, opening access to better education, enforcing discrimination things in the workplace, improving the diversity of the healthcare workforce so that your doctor looks like you. Things like that lead to better care, increasing access to preventive health measures that can pay off in the long run. All those things can contribute to it. So I think, our country is a work in progress, and we're getting there. But we have to recognize, be aware of the differences that are all there, but haven't been documented sometimes before, to the extent that now the Healthy Aging Data Report gives hard data on the differences that we see in different communities. And I personally, if I had a magic wand, I would surge resources to the communities that had hardships, that had low rates, that were not experiencing health equity, and try to are there ways to make it more walkable so physical activity can increase? Are there ways to increase safety so that people feel safe going out? Is it possible to have mobile farmers markets so that there's greater access to fresh fruits and vegetables that can contribute? So there's a lot of things, and very often those solutions, I think the best ones come from the people in those communities. They know what they need and what the priorities are. And so let the people in the community tell us what they need, and hopefully our policymakers and service providers will be responsive. And if not, then there'll be advocates like us fighting for them. So that's sort of how I imagine it. But that's a big question and a big problem. So thank you for asking it.
Yeah, well, and to build on that, this topic of disparity a little more. The data certainly points out that we do have some disparities in health outcomes, some significant disparities in health outcomes here in Connecticut. But we're also the most diverse state in New England. So, does the fact that we are more diverse lead to more disparity than what we see in other states? Or does having this more diverse population mean that we see less disparity? Or, are there kind of too many factors involved in that to draw clear lines?
Yeah, I would be cautious to draw a straight line from the diversity to the disparities, because sometimes the disparities arise from successes. It may be that you have, at the healthier end of the scale, maybe you're doing better than other states. And it makes what's basically the normal spread look more pronounced, because you've got a lot of people who are experiencing optimal or healthy aging. So it's still to be determined. We're just pointing out there are these huge disparities that exist, and we should recognize them. But it could be tied to the more diverse population. It could also be tied to several factors that we haven't looked at yet.
And in terms of factors that we look at, you had mentioned that the Connecticut report has 190 indicators of healthy aging. How do you choose those indicators? How do you how do you say this is related to healthy aging, more or less than other indicators?
Yeah, it's a mix. We're data nerds, the people in my research group. So we are into data and always looking for new indicators that we can report, but we're also gerontologists. And so this is, things that we've studied for 20 and 30 and 40 years for some of us on the team. And then we listen to the people, our state partners, to find out what are the indicators that would help them. When we started, we had a theoretical model of healthy aging and tried to recognize that there were individual factors, and then there were family factors and community factors, health system factors, and then policy factors that could influence healthy aging. And we wanted to report indicators from each of those levels. And then we also consulted the World Health Organization, the 8 domains of age-friendly communities, and tried to have indicators that would map to each of the domains, so that if communities were taking steps or states were taking steps to become more age-friendly or more livable, to use the AARP language, that they could measure their success over time and see if they, what they were trying was working or not. But we often get our best suggestions, or I think great ideas, after we release a report, and then we meet with people around the state and tell them what we found. And during those community meetings, people say, well, what about this? And in one of our preliminary meetings with Connecticut, people kept mentioning that there were questions about hospice that were state priorities. And so we were able to buy a file related to hospice care and added those indicators to the Connecticut report and also the Rhode Island report, which we completed in 2020. So a lot of it, we have our theoretical framework, but we're always trying to expand it. And in fact, now we're thinking about what are some early childhood indicators that may be associated with late life outcomes, and can we incorporate those in the future? So, but at some point we have to stop, because it'll take us 5 years to do a state. And so we've got to, I've sworn we won't go over 200 indicators. So we've got about 10 more we can add, and then that's it. So, but thanks.
Yeah, it's interesting to think about, though. And I think, you've touched on this a couple times during the conversation, that we tend to think of aging as, something that starts at 60, like now you're aging, maybe you were something else before, but now you're aging. But it's a lifelong process. Like we're aging from go, and we tend not to think about that. But that's something really interesting, and I think important to keep in mind that we do need to be looking at how we're encouraging health for toddlers if we want to reach 70 and have some of these positive health indicators.
I often make that point in one of the undergraduate classes that I teach, and it's a lot of fun to hear 18 and 19 and 20 and year old people start to think about what their longevity will be like and what they'll do now so that they have a healthier 80 or 90 or 100-year-old experience. So it's fun. It's fun to think about. And I think it empowers people, actually, if you can start doing things so that you have a healthier, happier later life.
And I think that's always very interesting, because the disease of old age has such a genesis in younger years, at a time that you're not thinking about your health in that way. You're thinking about where you are today, and not necessarily thinking about, well, what's the impact 20 years from now from my doing whatever behavior it is that I'm doing. And suddenly to have that consequence, somebody saying to you, well, when you were 40, if you would have done this, you wouldn't be having this problem right now. It's like, oh, that's not good. But that's one of those things that, is challenging to help people to think about that. I know we do some work in Disrupt Aging, where we're working in classroom, helping college students to realize what it means to age. And one of the things that we always bring to their attention is that you're always aging. And so the consequence of what you do today has ripples throughout your lifetime. So, really talking about those various stages, which is, I think, part of what you're talking about, is it's not just looking at what the consequence of things, but how to ameliorate that consequence earlier in life, so that we don't have as broad a health disparity as we might. We're never going to be completely healthy, but we can be as healthy as we possibly can. Right. So
yeah, no, I totally agree.
If you were to think of one thing that we should be doing here in Connecticut, what would it be?
And it builds off what you were just talking about. If you're an individual, start to plan for your longevity. If you're a community, start planning for long-lived people to be in your community. And how can you individually, are you saving money so that you have resources? Look at your housing situation. Is that a home that will support you when you may have mobility limitation? Look at your relationships. Are you investing in relationships, which are key to healthy aging? And are you taking care of your body and your mind, so that, and do you have something that gets you out of bed in the morning? Is there a passion? Is there a purpose? And I think if, as individuals, we can focus on those things, and if we can have people focusing on those things, activating their communities, then we'll be in great shape, and it will be a place that we would all want to live in, whatever our age. But it's getting people to maybe wake up, I think, is what I'd like to see.
Yeah, and I mean, thank you again to you and your team for putting this report together. I mean, with 190 indicators, there's so many more questions that we could dive into, and probably each indicator could be its own conversation. For folks who are interested in digging in and learning more, it's healthyagingdatareports.org for the full report and for more information. Beth, thank you so much. This was a really good conversation, and we might have to have you back, to dig into more of these items later. I do want to mention that on August 4th, at 1 p.m., you're going to be our guest for a webinar that will go into more depth for this Healthy Aging Data Report. So folks want to go to aarp.org/CT and look at our events page. We'll have links for how folks can join that webinar at 1 p.m. on Wednesday, August 4th. And we'll have some of the same crew. Tia will be there, Beth will be there, I'll be there, and we'll also have a great panel of Connecticut policymakers and experts to dig into this report even more.
Great. Thank you.
Thank you so much. Great. And thank you for a wonderful report and for making it as easy and comprehensible to read, because a lot of times things come across and there's so much data, and it's really sticky sort of stuff and hard to get through. But I really found this was very conversational, easy to read and understand, and you really put a lot of effort into that. So it made it accessible to people like me who aren't really policymakers or experts, but are interested in and want to be advocates. So thank you so much for that. That really helps make this even more impactful a report.
Great, thank you. And if you have ideas for future indicators, just let me know. We still have a little space. We can add a few more.
No more than 10 suggestions.
That's right.
Great. Well, thank you again. This has been another great conversation for Coffee and Tea with AARP Connecticut. We hope you'll join us again in 2 weeks for our next conversation, and have a great day.